Good evening, everybody. Thanks for coming to hear about two topics that may seem like they go together or may not, Wikipedia and health. And of course, there's one other topic, which is libraries. So that's what I'm going to talk about just for a few minutes. And first of all, I thought I'd start with the Wikipedia side of the equation. So what do we know about Wikipedia? First of all, it's immensely popular. Wikipedia is the 5th most used website in the entire world. And that means 500 million visitors every month. It gets 21% on average of daily internet traffic and 200 million page views every single day. We all use it, you use it, I use it, it's everywhere. Something that might seem really obvious or not is Wikipedia is, in fact, an encyclopedia. It's kind of a weird, newfangled version of an encyclopedia, but it truly is. It's a tertiary source. It's there to not just be a collection of someone's opinions, but actually to digest and collect and organize secondary source and primary source information. What makes it unique is that this is done in an open, online, transparent, continuous effort, unlike a printed encyclopedia that's done through a publishing process and then released into the world. Wikipedia is that process is always happening, and it's always available for anybody to see anytime. So with that, because it's an encyclopedia that's always in progress, always being written, always being edited, always being iterated, there is a big focus on reliability, right? So how do we make sure that that information is up to date and reliable? Another interesting thing about Wikipedia is that it's a community. It's of course, the Wikipedia itself is open for anybody to use for free who has an internet connection, and but there's also behind the scenes a whole community of 31 million registered editors who work on developing Wikipedia. Of those, about 117,000 are more regular editors. That means that they do edits at least once a month. These editors are quite passionate, and they've really created a community that they actually refer to as a movement. And that movement is around keeping Wikipedia open and available for all. Another thing about Wikipedia is that it has no owners. It's all funded through crowdsourced funding. And there's also not really any rules. In fact, there are plenty of guidelines, and there are community norms that have been established and that the community itself reinforces and evolves over time as needed. What is really interesting is Wikipedia's vision statement, which is, and this is really coming out of the Wikimedia Foundation, where this whole community is imagining a world in where everybody has access to free, open knowledge across the world. And that's the commitment and the vision. And I think that really strikes us as being a very strong alignment with the vision of libraries. And that is the thing that sparked OCLC to think about, how do we bring these two communities together, the Wikipedia community and the library community, since their missions are so well aligned. That spark led to a project that OCLC led with generous grant funding from the Knight Foundation and the Wikimedia Foundation to do a project which we called Wikipedia plus Libraries Better Together. And this was an opportunity for, in particular, public library staff in the United States to get introduced to the inner workings of Wikipedia, go behind the scenes, see how Wikipedia was built and constructed, and learn how they could engage with that process and help people use Wikipedia more effectively. So we created an online course that was that ran about 9 weeks in the fall of 2017. And with that, we said, that was really fun. What do we do next? Well, this brings us to some of the things that we learned out of that project. So we did the course, and then we watched and see what did the librarians who took the course do. And it's just a really fascinating range of activities. This is, one is to say, well, we can use Wikipedia for information literacy training, considering everybody uses it all the time, whether they're told they're not supposed to or not, they're using it. So how can we use this as a tool for helping users, in particular of online information, be able to recognize reliable information when they see it. And also, some of them took it upon themselves to advise faculty and school administrators about appropriate use of Wikipedia. So they were aware from students coming into their library that the students were told, we cannot use Wikipedia. And they said, well, that seems like kind of a blanket statement. Wikipedia, yes, there's an appropriate use and a not appropriate use. It's a fantastic first stop for your research. So some of them actually went and talked to their school administrators and faculty, who then revised their policies to allow more appropriate use of Wikipedia in the classroom. So that's part of that guidance. Then when students and researchers are coming in mind, when library staff themselves know what's appropriate use and how to effectively use Wikipedia, then they're more confident guides of those students and researchers. Another example is to host editathons, and that is a really cool idea where you invite your community to come in and edit an article or articles on Wikipedia that are particularly relevant in that community. So, for example, in Kansas City, jazz is a very important local part of the Kansas City culture, so they invited jazz musicians, partnered with the Jazz Museum, and edited pages particular to the jazz artists in their community. So those two where you can add local knowledge. There's also the One Lib or One Lib, One Ref event, and that's held, currently it's been once a year, held where library staff are invited to just put one reference in one article in Wikipedia, and thus improving that article. And it's just a nice, easy, get your toe wet into the idea of Wikipedia editing. And then finally, some of these librarians got involved in specific Wikimedia projects, and these are projects that have particular goals like elevating women's contributions in science on Wikipedia. That would just be one example. So that's kind of you have the ultimate thing where a Wikipedian or a librarian gets so involved in Wikipedia that they become a Wikibrarian. If you just want to know more about that project, you can find resources on WebJunction. I've got a little friendly URL here for you to go visit. Okay, so now I'm going to turn over to the health side of my talk. And so we're aware of Wikipedia use. We understand where people go for it. Everybody uses it. Well, another thing that everybody's doing online, or at least 80% of adult internet users, is searching for information about health and medical topics. This stat comes from a Pew Internet Research study back in 2013. And we know that as of last year, 89% of US adults are on the internet. So that's quite a significant number of us who are searching for health information online. I read another stat that 1 in 20 Google searches is also for health information. And also that people spend more than 52 hours each year looking for health information, which is way more time that they spend in an actual doctor office or with a health practitioner. So what are internet users looking up? Here are some of the most common things that came out of that Pew Internet Research. The most prevalent thing is to research a disease or medical problem, but you have also medical treatments or procedures, issues around diet, nutrition, vitamins, exercise, fitness, prescription drugs, alternative treatments, health insurance, depression, anxiety, stress, and also researching doctors or hospitals. Well, now let's tie it back to Wikipedia. So Wikipedia has many, many, many articles on health and medical topics. So the most recent stat that I looked, because they count these a lot, is 223,784 articles in 281 languages. And just 34,500 in English language alone. And these articles have received 4.67 billion page views, and that's just in a year. And they have 1.5 million references in those articles. So when we say everybody uses Wikipedia, this includes health professionals. It is the single leading source of medical information for patients and healthcare professionals. So over 50% of physicians do use Wikipedia as a health information source. 94% of medical students, 70% of early career doctors, and at least 35% of pharmacists also use it. And also that there's evidence that suggests that science articles referenced in Wikipedia receive more citations. So basically, if the work is cited in Wikipedia, that is spreading those journals, that research further and faster. And it gets it to people that may not otherwise have had access to that journal article if it's behind a paywall. I have a few other interesting research stats that I'm going to check my notes for. So a 2009 study of junior doctors in the United Kingdom found that 70% of them used Wikipedia to look medical information up at least once a week. And while only 30% of them use PubMed. They're going to use these differently, though. So Wikipedia is for background reading, of course, while PubMed and those other kind of more best evidence sources, those we're going to ask for, get specific questions answered about specific decision making on medical things. So great background source. And then a 2015 study of psychiatry residents at Harvard Medical School found that they were using online resources twice as often as they use printed resources. And the three most commonly used sources were UpToDate, which is a source I'm not familiar with, PubMed, and Wikipedia. Wikipedia is the third most used by the psychiatry students. And Wikipedia used the highest ranking for ease of use. However, it was considered the least trustworthy of those three, which we can certainly understand. So with that, I think the medical community became aware of this prevalence of use and understood that they needed to take accountability for the information on Wikipedia related to those topics. So we have a number of folks in the health profession and medical profession who are active Wikipedia editors. So there is a study that shows that possibly half of the editors of medical articles are healthcare professionals, working healthcare professionals. And there's also, beyond that, medical students who comprise another percentage of those editors. But it's a small pool. So when you look at the dedicated editors, those who are making more than 250 edits, we have just about 300 people that are trying to keep, those 34,500 English language articles alone up to date. You just have about 300 folks. They made over 250,000 edits in just 1 year. So we have two things going on with that. One is there are errors of omission that remain an issue. And truly, that's not of no one's introducing false or information. It's just they can't cover all of that all at once and keep it all up to date. So you just have pockets where articles have not been up to date. And then you have readability issues. I mean, if you're going to have those in the healthcare profession writing it, they're writing it for a highly trained audience, and so you have that kind of curse of knowledge where they're not writing for the general reader. But we understand from those stats I did early, you have a lot of general public that are going to these articles to learn. And then we also have the same demographics that you see across Wikipedia editing in general, which is it's overwhelmingly male. There's estimates that it's about 80% male from one study. There has been then a concerted effort by the medical community to, though, as I said, improve those medical articles. And one of those hallmarks, of course, of quality are references, the number of the references and the quality of those references. And this graph shows the growth in the number of references that have been added to medical Wikipedia articles, and it goes from 2009 to 2015 was the most recent thing. And you can see it's been quite steady. This, I just want to credit Dr. Jay Heilman for this and a lot of the information about the medical information on Wikipedia. So we can expect that this trend has been continuing, this rise in the quality. Okay, so now we circle back to the library. So how can libraries support health information seekers? So this is a question that OCLC was asking, and we also have been talking with the National Network of Libraries of Medicine, who has also been looking into this question as well. And so we have, some obvious things that we think are great ways for librarians to engage. And one is just similar to as we did with the earlier program, is understand how to guide appropriate use of Wikipedia for health information. Just like those medical students, they used it for background reading, but maybe not to make that decision without having an actual consultation with a health provider. We can also have health topic focus editathons, or focusing on adding references to those medical topics. Let's grow that 300 strong group of editors to even more. The improvements that are most needed, again, is that improving the readability for a general audience and adding citations to high quality reference. There's also an opportunity to get to know medical Wikipedians. So with our Wikipedia Plus Libraries original project, one thing that was wonderful to do was to have actual human Wikipedians, kind of come out from behind the Wikipedia wall and meet public librarians. And so they could get to know each other as people and understand how they could work together. So this is an opportunity there. And then finally, there's wonderful community consumer health initiatives and projects coming out of the National Network of Libraries of Medicine that are great opportunities for libraries to engage with. And NLM has gone into the editathon world in most recently, so running 3 over the last year. The first one was around rare diseases, so focusing on articles that are with the subject matter of rare diseases, adding references, high quality references to those articles. And then the second one was focused on women's health issues, a topic, again, if you look at that editorship of 80% male, I think we can say that the women's topics may not be getting the attention that is needed, so this was a great subject. And then the most recent one was around elevating health equity. And I pulled the stats from the dashboard from that editathon, so how you can see just how a one day of people working together can have such great impact. So in that third editathon, you had 54 editors who edited 42 articles, making 134 total edits. Well, that added 7,000 words, and the view of those articles, we have 851,000 to date. So a little goes a huge way. So this is what I'm really excited to talk to you about, is what's coming up. So WebJunction, which is the program that I'm the director of, has partnered with NLM, and we're going to offer a course coming to you this October. It's going to run for 4 weeks online, and it is free. And we welcome all y'all to register for that when we open it up. To pique your interest and give you a little more information, we're going to have a preview webinar. We've just announced it. It's going to be on August 14th. And it's going to be on this topic, Wikipedia plus libraries, health and medical information. And at the webinar, it'll be presented by WebJunction's Beth Aguchi and also Liz Waltman. And she is the Outreach, Education, and Communications Coordinator for the Southeastern Atlantic region of NLM. So please join us there. And then there will be an editing event in the fall of 2019 with NLM hosting. So it's all coming soon. So thank you very much.